Hi, everyone. My name is Anja Srienc. I'm a PGY6 resident at Washington University in St. Louis, and I did my MD PhD at the University of Minnesota. As a resident, I've come to learn that doing research isn't quite the same as doing research as a medical student or a graduate student. So I wanted to talk about balancing clinical education and research and share with you some of the lessons that I've learned trying to do research as a resident at a busy neurosurgical center. To start off, I wanted to go over a few universal principles. So first of all, the top priority of junior residency should be to develop a strong clinical foundation. The skills that you learn as a resident are going to be the foundational skills on which you'll rely for the rest of your career. So becoming the best clinician and the best surgeon that you can be is really important. Next, don't be intimidated. Trying to take care of your patients, prepare for cases, and do research can be pretty overwhelming. So it helps to break things down into achievable steps. If you do a little bit a day, that's better than doing nothing, and you'll be surprised at how far you can get. Next, self-reflection is useful. Think about the types of patients that you like to take care of. Think about the clinical and scientific problems that you find interesting. Who are the mentors that you've had who have been good role models, and who are the mentors that you haven't worked with so well? Figuring all this stuff out will help you identify and look for an environment where you can be most successful. Fourth, you can expect that everything will always take longer than you think. And finally, take advantage of opportunities even if they weren't part of the original plan. You might find that you have a conversation with somebody that sparks an idea for a new project that totally takes off, or you might become involved in a project that snowballs and goes in a totally different direction than you expected it to. These types of changes can be really exciting and totally boost your career. And if you don't have an area of subspecialty that you've identified yet, these types of opportunities can help you focus in on an area of neurosurgery that you can devote the rest of your career to. So how and when do you get started doing research as a resident? I wanted to review finding a mentor, finding a project, identifying relevant deadlines, applying for grants, thinking about other goals and obligations, getting organized, and having fun. So to start off, how to find a mentor. I think the first step here is really thinking about what do I need to be successful? And this gets back to the self-reflection thing. Think about what types of mentorship or communication style has worked well for you in the past. What kind of scheduling flexibility do you have and do you need your mentor to have? Are you going to be on clinical service the whole time, or will you have protected research time? Are you somebody that does well meeting with your mentor just once or twice a month, or do you want more easy access to your mentor? Think about your goals. Are you hoping to learn a new lab technique? Are you hoping to publish a bunch of clinical papers? Figuring these goals out are going to help you find a mentor that can help meet them. And then consider what projects you might want to work on. Also thinking about the scope of the project and thinking about how much dedicated time you might have to doing research. So then once you've figured these things out, you can start looking for it. It's really never too early to start. And in fact, you can start as early as your intern year. Remember that it's okay to look outside your department because there's a lot of neurosurgically relevant research being done outside of neurosurgery departments, and PIs would be thrilled to have a neurosurgery resident working for them. Talk to the grad students, postdocs, and other lab members of a group that you might be interested in joining, because these guys are going to give you some insight into the type of culture that research group might have and whether it's a culture that you can fit into. And then figure out what's going to be expected of you if you decide to join that group. Is your PI somebody who's going to expect you to be in the lab 20 hours a week, but you'll also be on clinical service? If so, that's probably not a relationship that's going to work out very well for you. And then also realize that people who have mentoring networks tend to do better in academic medicine than those who do not. So consider the fact that maybe just having one mentor is not enough. Depending on what you want to do, it might be beneficial to you to build up a network of mentors and have sort of an advisory group that helps you navigate your project. Next, how do you find a project? First of all, be open-minded. If you found a mentor that you're really excited to work with, but the projects that are available might not be exactly what you were interested in, consider the fact that as you learn more about a topic, it becomes more interesting. Also think about the types of techniques that project will involve. Do you really hate programming, but the whole project involves heavy data analysis and a lot of programming? That might not be the best fit for you. Also remember that you're still a resident, and so you're not a PhD student and your project is not a PhD. You won't have the type of time that a graduate student does to devote to a project, so remember to keep that scope of the project narrow enough that you can really see it through to the end. Consider how your project will fit into your long-term goals. Is this in an area of subspecialty that maybe you're interested in pursuing? Or is the project going to help build your skill set and build up your CV by getting you more publications? Your project really should get you something tangible by the end. So also don't put all your eggs in one basket. So it's important to invest in longer term projects, but the payoffs from longer term projects may not come right away. So it's also important to maybe find a project that you can work on in parallel that's a little bit closer to the end, and you can help get it across the finish line and get that abstract or get that paper early on. Identify the support team that will be available to you as you work on your project and use their strengths. These could be medical students, graduate students or postdocs, lab technicians, or your mentor team, because these are going to be the people that you can turn to when you hit a hurdle or you're needing to troubleshoot something that's not going well. And finally, remember your clinical obligations. Think about how much time you're going to be expected to be working on clinical service and how much time you actually have to spend on research. So if you're on full-time clinical service and you're thinking about a project that's going to require many hours at a time to do an experiment, maybe that's not the best fit project for you. Then identify relevant deadlines. So figure out whether your department has deadlines. Is there an annual research day that you're expected to present at? Is there a deadline to commit to a lab? Are there departmental awards that you can apply for? Consider grant deadlines if you're going to be applying for funding. And also think about abstract deadlines so that you can get out to some of the national meetings and present your work. And then from there, work backwards. Figure out what you need to do to get those abstracts submitted, get those other project proposals submitted, and that will help figure out how to prioritize. So if you are going to be thinking about applying for grants, here are a few thoughts regarding that. So first of all, why apply for a grant at all? Number one, I think you can get salary support with the grant, and it can help pay for research equipment. Grants are also a great way to get travel funds and pay for going to conferences or going to courses. And importantly, they establish a track record that you're capable of writing a proposal that gets funded. And in the future, this will be important if you are looking to apply for more grants. Use your mentors to identify relevant funding sources. The NIH is great, but usually those are longer, bigger grants. And so if you don't have dedicated research time built into your training, sometimes these aren't the best grants to apply for, and rather it might be better to apply for some smaller foundational grants. And then there are also internal grants that you can apply for within your university. Think about the scope of your grant. You want to understand what the duration of funding is going to be and how much money you'll be getting, and this should help you guide how big of a project you're proposing. As a trainee, remember that the components of the grant are not just about the science. You'll be applying for career development awards, and so the training plan that you write up, the type of training that your institution can provide and that your mentor can provide, are just as important as the actual science that you're proposing. And so to this end, you should be seeking a lot of feedback from your mentor and editing iteratively to make sure that your grant has all of the components that it needs to have. And this is a process that is probably going to take you longer than you think. Grant writing is really not a solo endeavor, and you should be seeking out feedback often and rewriting your grant several times over, because this will make you more successful and more likely to be funded. And finally, remember that the grants office is a good resource. People tend to forget that the grant is actually due to your institution earlier than the actual grant deadline that's listed on the website. This is because there's a number of administrative paperwork that goes around actually getting the grant submitted. So work with your grants office to figure out exactly how much lead time they need and make sure that they have all the documents that they need so that you can meet your grant deadline successfully. Then, if you have research time, think about other goals or obligations. Are there professional goals? Do you need to do things like study for boards? Are you going to be expected to take backup call or primary call? Will you have fellowship or job applications and interviews? This might eat into research time, and you want to plan accordingly. The other consideration you want to make is all of your personal goals. Are you thinking about starting a family? Are you hoping to attend some family events? Are there other hobbies and goals that you've had to give up during junior residency? And if you're on a dedicated research month or research block, you can revisit. These are equally important and help prevent burnout. Then get organized. So triage and reprioritize your to-do list often. New deadlines will pop up, and trying to figure out how to prioritize everything can be challenging. So make sure you're visiting that to-do list and figuring out what's the top of the priority list to be able to meet the deadlines that are coming up. You can set your own smaller deadlines to try to stay on task. Get quick projects done early to meet those early abstract deadlines so that you can start getting out to the meetings as quickly as you can. And then remember that investments can pay off later, but to reap those benefits, you need to keep that project on track. So to do this, make sure that you're scheduling regular meetings with your mentors and with your team to stay accountable and to make sure that you're making the progress that you want to make. Finally, have fun. This is a really cool chance for you to work on stuff that's interesting and meaningful to you. You get to become the topic expert in your area. You can collaborate with friends, and you get to go to meetings, courses, and hang out with people. And so to end, a few practical tips. You really get what you put into it, and so make sure you're prioritizing what's important to you and spending time on that. You can carry your computer and tablet with you so that you can take advantage of pockets of time to read and write in piecemeal fashion. It's pretty hard to write an entire manuscript in a weekend, but if you set yourself a goal of writing just the first paragraph of the introduction in an afternoon, that's very doable. If you have dedicated research time, try to get IACUC and IRB approval before your research time starts so that you can hit the ground running. Or you can even try to weave this into your other clinical obligations to try to get all this paperwork done so that you can get working on some of your projects even while on clinical service. Remember that research rarely goes as expected, so don't be surprised if you hit hurdles or roadblocks along the way. Make sure that you're investing your time in endeavors that are useful and will really get you a tangible product at the end, whether that's a publication or an abstract, learning a new technique that will serve you in future projects, or networking with somebody in your field. And finally, don't forget that you're a surgeon. You do this to take better care of your patients and to contribute something to the field to make patient care better. And so with that, I want to acknowledge Dr. Zippel, who's been a good neurosurgical mentor to me, Dr. Culver, who's my research PI, Sangami Pugazenthi and Aaron Walker, who are two medical students who helped prepare this presentation, and most of all, the CNS for inviting me to give this talk. My funding sources are listed below, and good luck to all of you. You'll do great.